In Alberta, starting tomorrow, residents 75 and over are eligible to be vaccinated and can book their appointments for both doses. So their booking system's already up and running. We won't even learn about the process for our over 80s until next Monday. So my question is, why are we behind Alberta?
Yeah, we have a different program than Alberta, and there's a number of issues around that. Partly, we have a different epidemiology, and we have a different demography here in the province. They have much fewer seniors over the age of 75, over the age of 70. So they have tailored their program to their circumstances, and we're tailoring ours to our circumstances. And our focus, the focus has been the same in terms of protecting those who are most at risk because of age. But we need to use the doses that we have and the population that we have and tailor our programs to our both geography and demography here in BC.
Shannon, do you have a follow-up?
I don't know if you've seen the Liberal health critic came out today publicly being quite critical of the lack of public information on the vaccine rollout. You said now there will be a press conference next Monday to at least unveil what will happen with people over 80, but other provinces have released some or part of their plans much earlier. So why not give out more information as you know it to keep people in the loop as the process goes along?
I think what you'll find is that we did tell you in as much detail as we knew the basis of the program. It has not changed. We are doing it focused on the number one risk factor with the vaccine that we have. And I think all of us across the country were thrown for a bit of a loop when our vaccine dried up for a few weeks. We've been using that time to put our systems in place, to get the lists of people, to make sure that we know exactly how and who we can reach out to, and we're providing that information as we go along. And it's been a challenge for all of us, and I think this is a grand scale. The other thing that we have to focus on is, we have been using all of the doses of vaccine we have to make sure that we are protecting those most at risk in our long-term care homes. That was our number one focus, and that we've seen has been incredibly positive and a huge relief for many of us, both in public health, but all the families who have people in care homes. We've also been addressing those outbreaks that we're seeing in parts of our community, in our acute care system, and making sure that our acute care system as well is protected so that we can provide care to everybody. So, these are things that take time, and now that we are starting to receive vaccine again, and we've got the building blocks in place for the foundations of our program, we will have those details for people.
I'll just say that in January we laid out in detail, we briefed media, we briefed the public, the vaccination plan was available, and we have executed that plan. And I think our public health officials, but our staff have executed that plan extremely well. There are occasionally stories of problems here and there, but in general, to have delivered in long-term care, in assisted living, to healthcare workers, to First Nations, to vulnerable communities living in congregate settings, to community care workers as we have, and to have done it in detail based on a plan that we laid out in advance is a real achievement. Now the next challenge will be even greater, but you made the comparison to Alberta. We have administered our vaccine, almost all of it. We received a little more yesterday, and now we'll be able to ramp up immunizations more in the next 3 days than we did in the last 3. But the vaccine proportionally comes in the same proportion of Alberta, and we're using all of it, which tells us how effective our campaign has been here. In Alberta, I think they're doing some good work as well. So it's not a race, but in terms of the share of the vaccine that is going into people's arms, we're delivering all of it, and really in a way that I think British Columbians can be proud of, protecting those who are most vulnerable, exactly as we presented in January. And now that we're ramping up to a different campaign, a more broader community campaign. There'll be more information, and we'll be providing that next Monday.
Richard Zussman, Global News.
To stay on this theme, and I understand we'll get more information on Monday, but one of the things I hear most from families of those over the age of 80 is how can you assure them that they will be notified and how that notification will work? So can you provide some clarity for those people waiting in terms of how they will be told it is their turn?
Yeah, there'll be a whole variety of ways. We recognize that not everybody who's over the age of 80 and living at home or in community or in independent living has the same access to things like the internet or a phone call or the ability to make those types of phone calls on their own. So we are tackling it from a number of different ways, whether that's receiving a postcard in the mail, which some people will, whether it's getting access through the home care services that you are being provided, whether it's through your specialty clinic that you're involved with, through the independent living facility that you live in. Those are all ways that we will be reaching out in the coming days and weeks to seniors in the community. And we will be making it abundantly clear and appealing to our community members. If you have a family member or a friend who is struggling, who doesn't know exactly where to go to find out the information, that you can support them as well. But we want to make sure that it's seamless. If we give out a number, for example, we know that it's going to be, a lot of people are going to phone it right away. So right now we want to make sure we have all of the systems in place so that we make it as easy as possible, particularly for our seniors and elders. And I know many in my life are very anxious to find out when their appointment is going to be, and you will get that soon. We want to have everything in place so that it is as smooth as possible. Having said that, I know that there's going to be glitches, there's going to be bumps. We will not let people be let behind. We will be reaching out to you, and we will be making sure that you get what you need as soon as we can.